Okay, so in this video, I'm gonna I'm gonna be doing inspection, um, palpation, active range of motion, passive range of motion, followed by end-field assessment, and then resistive range of motion of the knee. So I'm gonna ask you, is it okay if I lift this up? Okay, I'm gonna just place it just down there. That's fine. So first, I'm gonna start with inspection. What I'm looking for is just any edema, swelling, muscle atrophy, any redness, or any pathologic signs such as like a weird instability. Lift your leg up. All right, the other one. All right. Looking at the inside. And that's it. So then I'm going to move on into palpation. With palpation, I'm going to start with temperature. So let me know if you feel any pain, discomfort, or anything, okay? Alright, it's the same. Going around, going down through the head. You want to go a little bit up. Check these quads as well. After that, I'm going to go into superficial palpation. Superficial palpation, I'm just palpating the bony structures, soft tissue a little bit. I want to move up as well. The same here by doing this bilaterally. Then moving on into deep palpation, palpating those lateral the epicondyles, the tibial plateau. Palpating the joint line, the knee joint line. Palpating the patella, checking for its movement. Any pain with that? Okay, pes on quads as well, those tendons. Then doing that same thing bilaterally, checking the joint line, checking the meniscus, MCL. Going up. Feel your head. Tibia, moving the patella, checking its motion. Yeah, no pain or tenderness. Now, I want you to go ahead and face down for me, sir. Here as well, just palpating the popliteal fossa, checking those tendons. Everything good? All right. Now I'm going to move into active range of motion. Can you scoot back? A little more, a little more. Alright, that's good. Goniometer. So, what I want you to do, sir, is go ahead and bring your. Actually, go ahead and tighten that knee. Try to extend it as much as you can. There you go. So, with him, I'm getting actually 0 degrees, which is normal. Now, go ahead and bring your heel up to your body. Okay. And I am getting, leave it there for you for a second. $140 degrees. Any pain with that? No? Any pain on extension? No? Okay. So that's the normal for extension. Again, 0 is normal, but it can be between 0 to 15 degrees. For flexion, it's 135 degrees. I'm going to do medial and lateral rotation. Okay? So go ahead and extend your knee like that. Now, I'm placing the center of the goniometer at the center of his heel. And what I want you to do is move it out like that and then move it in, okay? Go ahead and neutral, relax. Alright, following with his middle second toe. Go ahead and move it inside for me, medial rotation. And he has 20 degrees. Now go ahead and go back to neutral and move it out without moving that leg. Moving it out like that. Perfect. And he also has 20 degrees. For medial rotation, the normals are between 30 and 40, and for lateral, for medial is 20 to 30, for lateral is 20 to 40. Did any of those cause you pain? Okay, so now I'm going to be moving into passive range of motion. So with passive range of motion, since none of that bothered him, I'm just going to be moving your knee around. Let him know that how's doing in okay? Alright. That feels like soft tissue approximation. Extension. Extending that leg up. That feels bony. Medial rotation. Tissue stretch. And tissue stretch for lateral rotation. Okay, sir, so now what I want you to do is try to bring your heel to your buttocks, okay? Go ahead. And resist my motion. Go ahead. As hard as you can. There you go. Alright, any pain? Alright, now what I want you to do is kick out. Kick down. Any discomfort? Okay, what I want you to do is try to do a continuous kick. Don't. Alright? Any discomfort? Alright. Now what I want you to do is try to bring this leg in. This foot in. Any discomfort? Alright, now kick it out. Pain or discomfort? No? I don't know if you can't see. He's just saying no, shaking his head. So again, that's inspection followed by palpation, followed by active, passive range of motion, and field assessment, and resistive range of motion of the knee. Okay, so this next test is also called the Lachman's test. It's also called the AKA Trilat test, or the Lachman-Trilat test, or also the Ritchie test. Most commonly though, Lachman test. So, sir, do you have any pain in your knee? Feel any instability? No? So this test is to assess the anterior cruciate ligament, and positive finding would be excessive anterior translation of the tibia, suggesting an ACL sprain. So what I do, since he said no, you would always start in the uninvolved side, but I'm just going to start here. I'm going to stabilize the quads, and then, so I'm going to do it this way, it's just easier. Alright, so stabilize the quads, and then grabbing the fibula and tibula, and then flexing that knee up to 30 degrees, and then just applying anterior translation onto the fibula and tibia, trying to bring that tibia up. This knee feels pretty stable. This again, stabilize the quads there, trying to apply anterior pressure onto the tibia there. Again, positive finding is excessive translation of the tibia, indicating a ACL sprain. Okay, so this next test is called the Drawers test. So Drawers test, sir, do you feel any pain in either knee? Instability feeling? No? Okay, so I'm going to start in the uninvolved side. In this case, I'm just going to do his left. Yeah. So I'm bending his knee up to there. What I'm going to do is I'm going to apply an anterior translation on the tibia, grabbing on the back. Calf muscles there. And then I start slow. If I feel it's stable, I can just keep going. He has a stable knee. I can also do posterior drawers, which is pressing down. He has a stable knee. Doing the same, pressing anteriorly and then pressing posteriorly. Anterior drawers, posterior drawers. Excessive translation in either side. If it's anterior excessive translation, that's indicative of an ACL sprain. Excessive translation on the posterior side, it's indicative of a PCL sprain. It could also be as well as an MCL sprain or the popliteal complex in there as well. Okay, so this is called the adduction stress test, also known as the varus stress test. So do you feel any pain or discomfort in either knee? Any instability? Okay, so what I'm going to be doing is I'm going to be applying some pressure onto your knee. Let me know if that causes you any pain or discomfort, okay? So adduction stress test again. So I'm going to apply pressure on the medial side while contacting on the lateral side. The pressure is going to be with my forearm doing a varus stress pretty much. Alright. So instability in the slightly flexed position, if I find it, I'm going to repeat it with a knee in extension, all the way in extension. So I'll repeat it with the knee all the way in extension. And then I didn't find anything, but if I find instability in the extension, it's also going to be a positive finding. So either in the flexion or in the extension position, like a laxity movement, is our positive signs. I'm going to repeat this in the other leg. So slightly flexed, contacting the medial epicondyle and the lateral epicondyle with my outside hand, and pushing in, varus stress, and then repeating it with a knee in complete extension. Okay. I already mentioned the positive findings. The test is indicative of an LCL sprain, inflection or extension, or it's also indicative of an ACL, capsulitis, or ACL or PCL or LCL sprain in the extension position. Okay, so this next test is called the adduction stress test or valgus stress test. So, sir, do you have any pain in either knee? No? Alright, so I'm going to start with this left knee. I'm going to flex the knee slightly, contact the lateral epicondyle with my inside hand, cephalad hand, and then push and while pulling on the tibia with my cephalad hand. Alright, and then applying that valgus stress, feeling for excessive laxity. If I find it, I repeat it with the knee in complete extension. Then I'm going to do the same on the opposite leg. Slight flexion, pushing the joint line in while pulling the tibia out. And then if I find gapping, I'm going to do it again with the knee in complete extension. Positive finding would be, excessive gapping in either flexion or extension. It's indicative of an MCL sprain when the knee is slightly flexed. When the knee is in complete extension and there's gapping, it's indicative of an MCL sprain. It could be also a problem with the capsule or an ACL or PCL sprain as well. Alright, this next test is called the posterior sac sign, aka gravity drawers test. Sure, I'm going to be moving your legs around, let me know if you feel any discomfort. So I'm just going to flex his knees to 45 degrees. And then make sure that the heels are level. And then I'm just going to be looking at the tibial plateaus. And that's it. A positive finding for this test is if the tibial plateau sag posterior in relation to the femur, and that's indicative of a PCL. Okay, this next test is called the Apley's distraction test. Sir, can you go ahead and face down? Turn over. So, do you have pain in either one of your knees? No. Okay, so he said no. You always want to start in the non-involved leg. However, I'm starting in his left. So I'm going to place one knee here, add internal rotation, and then distract. Did that cause you any pain? No. Alright, so I'm going to do external rotation and distract. Any pain with that?
No.
Okay, and then I'm going to repeat the procedure on the other leg. Pain with that?
No.
Okay. Pain with that?
No.
Alright, so this test is positive if he either has pain or relief of symptoms. And if he has pain, that's indicative of a ligamentous sprain. If he has relief of symptoms, that's indicative of a possible meniscal injury. Okay, this next test is called the McMurray's test. Sir, do you have any pain or discomfort in either knee?
No.
Okay, so you always want to start in the non-involved side, but I'm just going to start with his left leg. So you grab the leg, flex the knee, and then apply some internal rotation while feeling on the lateral joint line, and then extend the leg. And then I feel for clicking, which I felt, I did feel clicking right there. And then I'm going to add external rotation while feeling on the medial joint line and extend. And as well, yes, clicking. Did that cause you any pain?
No.
No? Alright, so I'm going to repeat that on the right leg. Internal rotation while feeling on the lateral side. Extending. And then external rotation, feeling on the medial side. And extending. So he had clicking in both knees. That would be positive. However, in his left leg, left knee, he had clicking on both the lateral and medial side. So that's clicking. Positive findings for this test is clicking or popping sounds, and that's indicative of a meniscal injury. So if you had clicking with external rotation, that's a positive for medial meniscal injury. If you had clicking with lateral rotation, that's a positive sign for internal rotation. That's a positive sign for lateral meniscal injury. This is called the bounce home test. Sir, do you have any pain or discomfort in either knee?
No.
Okay. So I'm gonna slightly lift up the leg. Let me do all the work. Relax. Let me know if you feel any pain or discomfort. Okay. So I'm gonna slightly lift the leg up. Pick up the leg behind the knee and slightly flex the knee, and then I'm dropping. So I'm gonna repeat that on the other side. For the sake of the video, I'm gonna stay here on this side. Lift the leg, slightly flex, and then drop. So a positive finding would be if he would bounce back and stay in this flex position, or if he would not go into full extension. And that's positive, and that's indicative for meniscal injury, meniscal tears. This is called the athlete's compression test. Sir, do you feel pain in either knee?
No.
No? Okay, so go ahead and turn upside down. Face down. So what I'm going to be doing is I'm going to be bending your knee around. Let me know if you feel any discomfort.
Okay.
So I'm starting with his left knee. I flex the knee to 90 degrees, internally rotate the leg, and then apply axial compression. Does that cause you any pain?
No.
So I'm going to repeat that with external rotation now, and apply compression. Is that painful?
No.
All right. Do you feel any change in your symptoms?
No.
Okay. I'm going to repeat that with the other leg. Internal rotation, apply compression. Anything?
No.
And now with external rotation. Any pain?
No.
Okay, so positive findings would be pain on either internal or external rotation, and that's indicative for a meniscal injury, meniscal tear. Right, so this is called the Thessaly's test. Actually, can you stand? Let's come over here. So in this test, what I'm going to ask you to do is go ahead and stand with one leg. Relax your knee a little bit. And then what I want you to do is rotate side to side 3 times. And let me know, did that cause you any pain?
No.
Alright, now repeat that with the other leg. My hands are here. If you feel like falling, you can go ahead and I'll catch you. Did that cause you any pain?
No.
Now, okay, now you're gonna repeat that, but now I want you to squat a little more. There you go. And then, so squat and then go side to side. Then I'll count you. Okay, any pain?
No.
Repeat that with the other leg. Any pain with that?
No.
Alright, so a positive finding would be pain in either of those movements, internal or lateral rotation. If he has pain when going on the lateral side, that's a positive. That's indicative of a lateral meniscal injury. Pain going to the medial side. Okay, so this test is called the patellar grinding test, aka Fauchet's test. So, sir, do you have any pain on either of your knees?
No.
No? So I'm going to be moving your knee around. Let me know if you feel any discomfort. So what I'm going to be doing is I'm applying pressure, pushing down the patella into the femoral condyle, and then just moving it around, displacing it back and forth and in various directions. Any pain with that?
No.
I'm going to repeat that on the opposite leg. Pain with that?
No.
So a positive finding would be if he had pain while moving the patella either under or over the patella. Pain under the patella is indicative of chondromalacia, arthritis, or some fracture. And then pain over the patella could be indicative of a patellar bursitis. Alright, this is Clark's test. Sir, do you have any pain in either leg, either knee? No? So for Clark's test, I'm going to be pressing onto your leg. Let me know if you feel any pain or discomfort.
Okay.
So I'm going to apply an SI force superior to the superior pole. And then can you go ahead and contract these muscles, your quads? Is that painful? So if that's not painful, I'm going to go ahead and raise his leg to about 30 degrees. I'm going to bend his knee to about 30 degrees. And then I'm going to repeat the same. Can you go ahead and contract those muscles? Is that painful?
No.
I'm going to repeat this at 60 degrees. Go ahead and contract. Is that painful?
No.
And then if it's not painful, I'm going to repeat at 90 degrees. Contract.
No.
So that's not painful. I'm going to do the same on the opposite leg. Go ahead and contract. Pain.
No.
Again. Pain.
No.
Again.
No.
And last.
No.
So if he had pain, either at full extension, at 30 degrees, 60, wherever he feels the pain, you stop. That's a positive test, and it's indicative for chondromalacia patella. All right, so this next test is called the Waldron's test. So, sir, do you have, what I'm going to ask you to do is go ahead and put your feet together and then squat down a little bit. Do you have pain in either knee?
Yes.
Yes? Can you point to it?
This way.
So he has pain in his right patella. You can go ahead and come back up. So I'm going to try to move it around. If you needs to be at the end of it. So I'm going to try to, I'm moving around the patella. And then, now can you go ahead and repeat it? Squat down. Is that better?
Yes.
Okay. So that's a positive test. And that's indicative of patellofemoral tracking disorder. If he had said, yes, I still have pain, I could continue moving the patella around until maybe he gets to the point where he feels like, oh, that's a little bit better. And that's a positive Waldron's. This test is called the stroke test, also known as the brush or bulge test. So I'm going to go ahead and, you can go ahead and relax your knees. So I'm going to go ahead and inspect the patella. And while inspecting, I might be able to see some redness, but I might not be sure if there's edema or some effusion there. So I can do this test to just rule out inflammation or some edema in that area. So let's say I saw some redness in his right knee. What I'm going to do, but I'm not sure if it's edema, what I'm going to do is I'm going to go ahead, So I'm going to go ahead and apply some strokes onto your leg. Let me know if you have any pain or discomfort, okay? So I'm gonna apply 3 strokes over the medial aspect of his legs. And what I'm trying to do is move that inflammation, move that liquid if there's any. And then on that third one, I'm gonna come lateral, and then I'm gonna go ahead and do that same on the lateral side. If I see a bulge going in the inferior medial aspect, if I see like a small bulge of fluid, then it's a possible test for us. It's a positive stroke test, and that's indicative of effusion in that area, inside intra-articular area. All right, so this is the Q angle measurement. I'm going to go ahead and ask you, sir, to relax. Just stand in your neutral position. Is that it?
Yes.
Okay. So I'm going to go ahead and place the goniometer at the center of the goniometer in the center of his patella, and then one arm is going to go in the center of his patella, down the middle of down the tibia, and then the other arm is going to go to his ASIS. Alright, and then I take that angle, and his measurement is 5 degrees for his left leg. And then I'm going to do the same for his right leg. And it's also 5 degrees. So, men typically have a lower angle, women have a greater angle. However, an angle less than 13 degrees is indicative of maybe some patellofemoral tracking disorder, perhaps patella alta, retroversion, decreased tibial torsion, also genovarum. An increased angle, anything greater than 13 for males or 18 for females, it's indicative of it could be anteversion, increased tibial torsion. It could also be a patellofemoral tracking dysfunction disorder, a subluxating patella, or a genovalgum.